Okay, so I think we're ready now. We're looking at Martha Brown. This is writing week. And as you guys know, during writing week, the idea is that we look at a set of case notes on a Monday. We make a plan together, and then throughout the week, you guys submit your paragraphs. I review them, review some of them in the class, get some common errors, and then maybe by the end of the week, we'll be able to have a session on Friday where we look at some of the kind of mistakes that people were making. My main focus is going to be purpose, content, organization. That's what I'm going to be looking for. Okay. There will be some language issues that pop up as well, but I'm going to be focusing more on those things because those are the things that will get you a pass in OET writing. All right. So let me go and open my study document, which is here. Okay, let me zoom in a little bit so it's a bit bigger. Yeah, this is what we're going to do today. We're going to find the purpose of a set of case notes. We're going to identify the case notes we want to use, and we're going to organize the case notes into logical paragraphs. Do you think that sounds like a good plan? Anybody? Is that a good approach?
Yes.
Yeah. Rita, why is that a good plan?
Because when we are identifying why we are writing it, the main purpose, that's the main idea behind it. And secondly, we are identifying the case notes. When we say case notes, what are we about? So we want to identify why, and we are organizing it. Organizing it like we are bringing out the layout why we are writing all this thing.
Yeah, and it needs to be organized, doesn't it? Because of this. We're writing a letter to a healthcare professional requesting continuation of care for a patient in some way. That continuation of care is not always obvious how it's going to be done, but this is important. And the reason why I say this is because I don't want anyone to say to me, how should I do a referral letter? How should I do a discharge letter? The question has to be, how should I do a letter? Any letter. All right. This is our ambition every single time we do a letter. What's the purpose? What case notes do I need? How do I organize it? That is always our approach. And I've got a set of questions for us to answer when we look at a set of case notes. Now, if you don't already know about paragraphing in OET, in this document, I've got some information about it. Okay, and we will talk about it today, but it's definitely a good thing to go and have a look at the writing course, the video writing course, where you look at things like the sandwich and some paragraph functions. Notice that I'm saying logical paragraphs. I'm not saying the same paragraphs every time. Okay, I'm not going to teach that. I'm not going to say always do this, always do that. It's just not like that. You've got to be a bit flexible. You've just got to think to yourself, what is the best thing for the reader? That's it. You've got to be professional and try and make it as easy as possible for the reader to understand what the task is that they're being asked. Okay. So, does anyone have any questions at the moment about OET writing in general? Is there anything that you think, I've never done it. I've got some questions. There's something I'm not sure about. Does anyone have any general questions about OET writing? I don't mind, even if you think it's a silly question. I don't mind answering it. No? For instance, some people are worried about word count. Don't worry about word count. It won't be counted. Okay. Gertrude, have you got a question?
Yeah, please, I want to ask, in OET, when moving to the next paragraphs, do you have to leave a line as it is done in IELTS, or you just move to the
next? It's always a good idea to leave a space, always, because then we're clearly paragraphing, and we're saying that this paragraph is definitely separate from the one before. And my advice would be leave a couple of lines, leave 2 lines. Because even though we want to plan well and we don't want to have to make late changes, there are sometimes where you think, oh, I need to put this bit in, I forgot. And so if you leave 2 lines, it gives you the opportunity to squeeze something in at the end of the paragraph. Is that okay, Gertrude?
Yeah, that's okay. Thank you.
Okay, good. All right. Any other questions? No? I like questions like that because, you know, when you're taking the exam, sometimes you might think no one can answer that question for me, or there might be just a little voice which you don't know how to answer the question. So if you do have any questions like that, let me know. All right, just let me know. Okay, so let's go on and we'll talk a little bit about paragraphs, just briefly, because I know we've got a lot of experienced students in here as well. These are generally the paragraphs that we're going to use. Okay, we've got introductions and requests in blue. The reason why I've got those in blue is they're always in those positions. Introduction first, request at the end. In the introduction, we're supposed to be general. We're introducing, this is the situation, this is the patient. And in the request, we're going into detail. So a good example there would be, in the introduction, you might say that they require assessment. But in the request, you might say they need an X-ray, they need a blood test, they need this, and this. And you'd go into the detail. I think that's a clear example of it. Then you've got your kind of timeline, chronology paragraphs. And then you've got your sort of more thematic, functional paragraphs like here you're going to have background. This is some information which isn't related to what's happened recently, but it's just something you need to know. And as I said, there are different ways. Sometimes you might want to start with the current paragraph. Sometimes you might just want to have a timeline paragraph. Sometimes you don't need to put a background paragraph in at all. It depends on who you're writing to and what the task is asking. Okay, so I'm not going to spend too much time talking about that today. Instead, I want us to talk about how we can do our planning. All right, so here are 6 questions. Really important questions. Now, I think that if you ask these 6 questions, by the end of that process, you will be able to do this. And that's, remember, this is what we're trying to work towards. Our ambition is find the purpose, choose the case notes, organize the case notes. That is what we're aiming to do today. Every single time you do a writing task, that is what you are looking for. So if you ask these questions here, you should be able to find the answers to those things. You should be able to choose the right case notes and organize it properly. So who am I writing to? Well, that will dictate the case notes that you include. You know, if you're writing to someone's GP, you don't need to tell them about their family history and their background. If you're writing to a specialist and doing a referral, that kind of information could be really useful for the person that you're writing to. If you're writing a discharge letter, then you don't need to put all of the specific details of how a patient has been managed in the hospital. Right at the beginning, if they're okay now, then we don't need to mention what their pulse rate was 7 days ago. That stuff's not really useful or important. So who you're writing to makes a big difference. Okay. What's the writer's task? I think that's a really, sorry. This is supposed to say reader, sorry guys. What's the reader's task? So what am I asking them to do? Okay, that's really important. This is switched around. Do they know the patient, as we've just talked about? Makes a big difference about what we include. This is the request paragraph. Does the writer have any tasks? Now, this is a difficult one to explain at the moment. It's quite a tricky one. Sometimes in a discharge plan, there might be a number of things that you want the person that you're writing to do. All right. But there might be a couple that you're doing. For instance, you might do something like discuss social worker with patient. Well, would we ask an endocrinologist to do that for us if we're writing to a specialist? No, we wouldn't. There might be other things like you've already done something, you've already organized a follow-up appointment. Okay, so that's an interesting one. It's better when we look at this one in context. Why am I writing today? Again, it just gives you a sense, it just centers you in the position of where the writer is. If it's a discharge letter, I'm writing today because today they're well enough to go home. Yesterday they weren't. Okay, if it's a referral, the reason I'm writing today is because this becomes such a big problem, I can't manage it anymore. And then, is it urgent? We always have to make sure that we include this in our introduction. So what I want to do is I want to give you guys this set of case notes. All right. And I want you guys to go into groups, spend about 10 minutes having a look at it. And when we come back, I will be asking, what are the answers to these questions? And then we'll go down and we'll try and make a plan in this table. Okay. We know that we're going to have an introduction at the beginning. We know we're going to have a request at the end. But what else will we have? How are we going to organize it? And I want you to talk to your fellow nurses about this in your groups. Khalida, you got a question?
Yes, Paul. Can you please explain a little bit the number 2?
Yeah, okay, let me have a look. Let's go back. Number 2, what's the reader's task? Okay, so if it's a discharge plan and you're writing to a community nurse, it might be that you're asking for daily home visits, to monitor blood or to change a dressing. That's the reader's task. Or maybe you're writing to a specialist and you're asking for assessment and a management plan. So those are the things that I'm asking them to do.
So like the reason why I'm writing?
Yeah, well, you could call it the purpose, but for me, the purpose is made up of the task and who I'm writing to and what the situation is. But yeah, basically the reason that you're writing the letter.
Okay, thank you.
All right. Okay, so have a look in the chat box, guys, and tell me what happens when you go into the chat box. Can you just click that? Does it open the case? What's the name of the patient, guys, when you click into it?
Martha Brown.
Martha Brown. Thank you, Ibika. Yeah. So, Martha Brown, this is it. These are the case notes. Okay. So, I'm not going to talk about them now with you guys. I want to put you into a breakout room. We'll come back and we'll review it together and we'll make a plan. Okay. So, let me set up those breakout rooms. We'll have 4 or 5 people, I think, in the rooms. Let me have a look. I think we've got 3 groups with 5 and 2 groups with 4. I'll put you into those groups. Is everyone clear on what I'm asking you to do?
Yes.
Is everybody clear, or just Rosa?
Yes.
Okay, good. Look, let me pop this into the chat box. These are the questions. I'm sure, even if you're not 100% sure about those questions, there will be someone else in the class that is in your group. When we come back, I'll be looking for volunteers to help me to answer these questions, and then we'll make a plan together. And then you can use that plan for the rest of the week to write paragraphs. Okay, I'm opening the rooms now. Okay, if you're at home, give yourself a few minutes, give yourself 10 minutes to have a look at this and do the job well. And we'll come back soon. Okay. So I think everyone's going in. If you're with us on YouTube, let's just have a quick look at the case notes. All right, let's have a look at the case notes together. And we'll let the rest of our students go into their breakout rooms. Shiromi, Manuru, Chandima, Daniela, can you go to your rooms? Yeah, okay. So let's go and have a look then. For the people at home and on YouTube, let's have a look at this. Okay, so I'm going to have a look at this bit first. So who am I? I'm a nurse in a hospital emergency department where I've been treating an elderly patient. Okay, the next place I'm going to go to is I'm going to go down to the task. Okay, using the information in the case notes, write a discharge letter, okay, to a community nurse. summarizing the hospital treatment and outlining her ongoing care needs. Okay, so I straight away am going to start answering these questions that I've just talked about. Who am I writing to? That's a community nurse. Do they know the patient? No, they don't. What's the task? The task is to provide ongoing care. Okay, let's go and have a look at the most recent date. I always look at the most recent date because that gives me the discharge plan. And the discharge plan gives me the activities that I'm asking this person to do. All right, so the patient agreed to fluid intake, refer to community nurse. Okay, here it is. Provide wound and dressing care. Excellent. Monitor UTI symptoms. Good. Encourage or monitor fluid intake. Okay. Monitor progress and report any problems to the family doctor. Well, that's great. I think that's a really clear set of things that I'm asking this person to do for me. So I've got already I'm thinking, there's my request paragraph. I've got that already. Okay, let's get those notes off. Let's think about the rest of it. Okay, what else have I got? I'm writing to a community nurse. So if they don't know the patient, then I have to consider what information do they need to know about the patient in the background. So lives alone, possibly. Okay, she's the primary caregiver. Oh, her primary caregiver is her daughter. Okay, but her daughter's away at the moment. Oh, that's useful for me to know. Okay, that's good. Rheumatoid arthritis. Okay. She had a broken ankle. Okay. What else happened? She's got diabetes. Now, I'm just going to go back and look at here what the plan is. So, no, it doesn't really talk about monitoring her medication, does it? Doesn't talk about that. So I'm not really that focused on this medical history. All right, let's keep having a look. So what was the situation? What happened to her? 4 puncture wounds on right hand, including deep wound near thenar. Okay, it's a dog bite. Okay, so she's had a dog bite. And that's 5 days after her daughter went away. She's her primary carer. Okay, so she's being treated for that. Okay, what's happened? She's got a bit of a fever. She's got a urinary tract infection as well. So she's been admitted for a dog bite, but she actually has a UTI. So the treatment, I guess, is going to be for that. We've got wound cleansing and wound management, but we've also got the UTI antibiotics. And now the patient's ready to go, and that makes sense for us. So I'm thinking this is going to be quite a standard plan. Introduction, timeline, where we talk about why she was admitted and the treatment that she's received. Maybe a background paragraph just to explain what her social situation is, and then a detailed discharge plan. That for me would be my organization for this letter. So for me, that's what I would do. I'd say introduction. If I could zoom out a little bit. Okay, I'd be thinking introduction, timeline. Okay, timeline, background with a bit of social. Definitely some social, possibly a bit of medical as well in there. And then a request. So I think it's quite a standard letter, this one. But if you want to find out, guys, how we organize it, how we choose the case notes, and how we do things like summarizing and conciseness and genre and style, come and find us, come and join us, and you can be in these writing weeks as well.